Thank you, Governor. Good afternoon. As the Governor said, we have 86 new cases of COVID-19 in Rhode Island. This brings our case count to 488. As I've said also on previous days, we're doing our best to report the most up-to-date numbers possible. This means that the numbers I'm sharing at these briefings are provisional. 6 of the cases from yesterday have been transferred out to other states. That is why we have 86 new cases for a total of 488 cases, despite the number that was reported yesterday. We know that this will continue to evolve, and we will work to keep you up to date on the information as we have it. As the Governor also mentioned, sadly, we have 4 additional fatalities. This brings our total in Rhode Island of people who have died with COVID-associated disease is 8. One of these individuals was a male in his 60s, and one person was a female in her 80s. The 2 other people were a male and female, both in their 70s. Our deepest sympathies are with these families. To talk more about testing for a moment, I want to provide some more background to what the Governor was discussing. To date, our testing has largely been focused on healthcare workers, hospitalized patients, and people who live in congregate settings, such as nursing homes. Those are our priority, most vulnerable groups that we need to address first and foremost. That will continue, primarily through the state health laboratories that has continued to expand to respond to those needs. With these new sites set up, we are going to start testing more people who are symptomatic and have a variety of components connected to them. People who have symptoms and are older than 65, people who are patients with underlying medical conditions and have symptoms, and people who have symptoms and are critical infrastructure workers, such as police officers and firefighters. These are whom we are expanding the testing to start, and we look to very quickly open it up even further to anyone with symptoms, even if they are mild symptoms. The key is working through a healthcare provider. We are working directly with healthcare providers to ensure that they know how testing should happen based on these groups and as we take these steps quickly. I'll reiterate that this process starts with healthcare providers. If you have symptoms of illness, please stay home. That's key first and foremost. Then you should pick up the phone and call your healthcare provider. Do not show up at any healthcare facility, whether it's an office or a building. It's important to call in advance. If you think you need medical care and have symptoms, particularly from one of the groups that I mentioned, you have symptoms and you're 65, you have symptoms and you have underlying medical conditions, or you have symptoms and you are a critical infrastructure worker, you should definitely call your healthcare provider, and they will walk you through the steps that we have shared with them, working very closely with healthcare providers. If you don't have a healthcare provider, you can call an urgent care center near you. Community health centers are also an option. Urgent care centers have been setting up respiratory clinics to specifically see people who have symptoms of illness that we want to address and get you directed to testing. Based on your symptoms and based on the updated guidance we are providing to healthcare providers, all providers are directing people to the places to be tested that have been set up. That's why it is key that no one just shows up at any of the drive-through testing sites and no one just shows up at a healthcare provider or an emergency department or other healthcare facilities. The key is to be able to call in advance, and going through a healthcare provider is the best way to facilitate this process so that there's someone you can work directly with to get your test results and determine next steps based on that. As the governor said, no one should be going directly to any one of the remote specimen collection sites. We are taking this approach to testing to test and protect our more vulnerable populations, and then quickly begin to expand out to anyone who has symptoms. And we're taking this approach to testing because it is imperative that our critical infrastructure workforce stays healthy, and they have the ability to support us as a state throughout this response. So that's why we want to make sure our police, our firefighters, our first responders all have access to what's needed. One other measure we are now taking to maintain our critical infrastructure workforce is allowing nursing students who have completed one semester to get a 90-day certified nursing assistance license, so that they can accelerate joining the workforce that we want to build out and have preparation for, both in our healthcare facilities as well as in our nursing homes. And there will be updated steps that we will share to talk about how you can take advantage of joining the workforce to be able to assist. We are sending guidance out to nursing schools today so that they can get information to their students about how to start this process, so that any nursing student who's completed at least one semester can accelerate to get a 90-day certified nursing assistance license. This also gives me an opportunity to share the updated guidance that we are providing to all healthcare facilities regarding masking. Surgical masks are helpful for the person wearing the mask to prevent them from having symptoms that spread to the person that they are exposed to. Surgical masks do not prevent the person wearing the mask from getting exposed to someone else who has symptoms. Because healthcare workers are a critical part to our infrastructure, and because healthcare workers are often caring for very vulnerable populations, whether in a hospital or in a nursing home setting, starting today, we want all healthcare workers to start wearing surgical masks. We have started to see that there are times when someone may not feel as they have symptoms, which is critical. We want to continue the screening to make sure no healthcare worker steps into any facility with any symptoms. But there are times when someone may be early on and not realize they have symptoms, or may even have symptoms that develop during the course of a day that they've gone in. That is why we are issuing this guidance to require all healthcare workers in healthcare facilities to wear surgical masks. I also want to reiterate what I was saying yesterday about the importance of environmental cleaning every 4 hours in nursing homes and other congregate living settings, as well as in healthcare settings. That means using EPA-registered hospital-grade disinfectants to clean high-touch surfaces, as well as to clean shared resident care equipment. As the governor mentioned, this podium, countertops, sink tops, doorknobs, those are all of the places that we want cleaning services to focus on a regular basis. We have started to see that this virus can be transmitted by droplet to surfaces where it can remain for some time unless appropriate cleaning is done to remove it. That is a significant way that viral transmission can occur. So we want all healthcare facilities, all critical infrastructure places as well to know about the importance of cleaning consistently every 4 hours, if possible, high-touch surface areas, doorknobs, countertops, sinks, anything that you know the public is touching on a regular basis. That's for our municipalities, firefighters, police, EMS, nursing homes, hospitals, the critical workplaces that have remained open all need to make sure that they are applying this environmental cleaning regimen effectively every single day. I want to make one last note. As the governor said, tomorrow is the first of the month, and I know this is a day when a lot of people go grocery shopping, including people who are recipients of food assistance. Number one, do not go to the grocery if you feel sick, even if you feel a little off. Do not leave the house. We will continue to work hard to expand the food delivery services so that fewer and fewer people actually need to leave the house. But if you are going to go to the grocery store, I want to tell you a few things to help you keep as safe as possible. Number one, please limit who goes. You don't need a big group going from one household. Choose one person to go to the grocery store for all of the people in those households. Number two, think about whether or not you can help someone else avoid a trip to the grocery store and combine it with that one trip that you are doing. We talked yesterday about thinking about seniors who are living home alone, those with disabilities who are living home alone. Check with your neighbors, check with your loved ones, check with your friends, and coordinate one grocery store visit for as many people as you can to limit the number of people who are going out. Then once you are out, keep a distance of at least 6 feet from other people at all times, whenever possible. To grocery store managers who we are working closely with, be aware of the guidance the governor issued last week about grocery stores allowing no more than 20% of stated fire capacity. And within stores, do what you can to ensure and enforce that people are standing at least 6 feet apart. This is the moment that we need everyone doing your part. Take care of yourself, stay home, take care of your neighbors and your loved ones. Each day that you are able to follow these critical rules, each day you can do better to protect yourselves, to protect your loved ones, and to protect Rhode Islanders.